Good day. The material in our podcast has been prepared and published for informational purposes only. Welcome to Family Matters with Reese Law. I'm Kate Reese. We are a family law firm based in Fairfax with an office in Prince William County. In this episode, we will be talking with Alexandra Herrera, MA, ATR, LPC. Alex is a licensed professional counselor who has owned Everwen Therapy since 2014, and she has held the role of clinical supervisor throughout that time. She also has extensive experience working with youth and young adults with emotional and behavioral disorders. She continues to work with these age groups as well as adults. In private practice, anxiety, depression, mood, and behavior disorders are common. She has worked in home settings with morning programs for the homeless, after-school therapeutic programs, therapeutic day school, and in private practice. She's helping to work with clients in a holistic manner by planning groups and retreats that incorporate art therapy, restorative yoga, and meditative walking, to name a few therapeutic interventions. Welcome, Alex.
Thank you, Kate. Happy to be here today.
Thank you for joining us. I appreciate it. As a mental health professional with a broad practice as to clinicians as well as areas of practice, tell us how you define self-care.
Self-care is a great topic. It's creating time and space to focus on an individual's needs. It's focused time that is mindful and meaningful. So you're really setting boundaries to take this time and focus on yourself. And you're putting yourself first when you're doing self-care activities. It's an act of taking time to understand and implement what is required for a person to recover from their daily stress and challenges. It is also knowing your limits and boundaries so you are able to successfully recover.
Okay, that's pretty important. How can you tell if someone is in need of self-care?
Kate, there could be several signs that someone may need self-care or engage in it on a daily basis. So their attention and focus may be impacted. An individual may feel feelings of fatigue. They may be overwhelmed. They may notice compassion fatigue, struggling to have empathy or sympathy for others. Burnout may increase. Feelings of irritability may also be on the rise. And during these time periods, it may be something that they need on a daily basis, or they may be something they need because something traumatic or significant has happened in their life. Maybe a major transition, a life change, a traumatic experience may have occurred. And these are times when it's important to really put yourself first and think about self-care.
Okay. And some of those traumatic events would include things such as custody disputes and divorces, correct? Tell us about the techniques you have found that help people.
So one of the most important techniques is breathwork. So oftentimes when we are anxious, maybe irritable, or we aren't engaging in the proper self-care, we'll find that our breathing has changed. We may hold our breath, or we may breathe more rapidly. And we're not giving our brain the signal to relax during these times. So if we really focus on our breathing, slow down, take deep breaths in, deep breaths out, it gives our brain a signal that it's time to relax and calm down, and it'll tell the rest of our body to follow in suit. So, deep breathing exercises, there are many of them. They're easy to engage in. You can do these anywhere. So we really want the body to feel like it's in a relaxed, calm state, and it's able to then engage in the next activities in a more mindful and healthy manner.
Excellent. Excellent. I've actually taught breath work to many clients of my law firm, specifically when we are going to a deposition or preparing for court, and it really does work, and it's pretty effective quickly.
Yes.
You don't have to do it for 2 weeks to see that it works, and that's always good. So we can use it on the spot as needed.
It can be used anywhere, and the key to breathwork is also to remain focused on it. So if it doesn't work in the first 30 seconds, that's okay. Just continue engaging in that practice.
Excellent. So healthy detachment is a way that people cope. Is that correct?
I mean, I encourage this with my clients. Go find an activity that you really enjoy and that you can just kind of close the door on the outside world and focus on you and the activity. You'll notice, I'm sure, that if you've engaged in some sort of maybe art activity or walking and you've lost track of time, that's okay. That means you're really in the activity. And some activities that may be helpful or work for people are podcasts, reading. I mean, reading is a wonderful way to engage in self-care. It has several benefits. It improves memory, it reduces stress, it will build up our self-esteem, and even help us develop our own skills. Meditation is another way to do it. Some people find it helpful to have meditation guide cards or self-guided apps and videos. Sometimes it's hard to just sit down and do it on your own. So, break it down, take a first step and use an app or a video on YouTube to help you engage in that meditative state. Other people enjoy focusing on their body. I mean, these are fundamental keys to keeping ourselves healthy, is engaging in good sleep, good fitness, nutrition, and emotional wellness. So people may go for more massages. They'll monitor their sleep, make sure they're getting that at least 8 hours of solid sleep, restful sleep. And that will be a helpful self-care technique for them. Guided imagery is another relaxation technique. We use this in the art therapy process sometimes. It involves visualizing positive and peaceful locations, and that's for the individual to decide. It may be a beach or a meadow. I mean, it could be a crowded city. It really depends on the person, what makes them feel calm and comfortable, but it's a technique that you can engage in pretty easily. You also don't need to take yourself away from things. You can just sit down and engage in a visualization or guided meditation. Guided imagery may help reduce stress and anxiety, and it also promotes relaxation and it eases the symptoms related to stress.
So I find that often people don't have a lot of self-compassion. Do you support any practice styles that combine well to help people be more self-compassionate?
Yeah, self-compassion is really important. I think, as you said, a lot of people miss out on this. It's just being kind to yourself, treating yourself with more care. And there are lots of different activities that can lend themselves to self-compassion. For instance, journaling, creating gratitude lists at the end of the day, or even focusing on what went well. What did you do that day that was successful? From the smallest to biggest thing. And that's important to focus on those positive behaviors and changes that you're making or engaging in. Yoga can be helpful. Restorative yoga, as you said earlier, it's something I want to start bringing to the practice more. It engages the individual in this really deep state of relaxation and helps the nervous system to relax as well. So it brings down stress levels. It can reduce blood pressure and produce feelings of calm and increased well-being. So those are great activities to engage in. Obviously, I'm a big advocate for art making. That's a great way to express yourself and to take care of your emotional, mental, and physical needs by engaging in the art process. Keeping socially connected can be a great way as well to fill those buckets. It is important as well to modify your environment, make it you friendly, so you want to be there. It feels good to you. Set clear boundaries and make time for things that you love. One other way to do this too is you can make attainable goals. I mean, we want to be successful, right? We don't want to see ourselves fail. That's what self-compassion is building ourselves up. So make a goal, break it down to small attainable parts, and go from there.
Excellent, excellent. Some therapists talk about taking an inventory. Is that something that you practice also?
Yes, I think this is very important. I use this with clients all the time. And it's checking in with yourself as often as you need to. And they're just little mental check-ins. Where am I mentally, physically, and emotionally right now? Have I escalated? If I have, let me take care of myself. Let me take some time away to de-escalate, bring myself back down to a nice, neutral, emotional and mental state. You may want to take this time to also identify if you've had any stress or triggers that have happened in your environment, and address them. It's a good way to be proactive to reduce negative and unhelpful responses in different settings.
Excellent. How often do you see self-improvement occur while someone is using self-care and working through a hard issue, like the division of their family or possibly the death of a family member?
So these situations are pretty difficult because we may see that splitting occurs in the family. Changes in the family dynamics or interpersonal relationships, stress can increase, triangulation, Poor boundaries may interfere with personal growth. So if somebody is engaging in self-care doing this, you oftentimes see great improvements in their mental and emotional abilities to manage these stressors in their life. Having a sense of self, a strong sense of self will be important. Self-care routine will be important. Maintaining healthy boundaries and keeping up with their own social network, so they don't get pulled into all that stress that's happening in the family unit. So they should be engaging in their hobbies that they like, seeing friends, and this will help them build confidence and allow them to engage in positive and healthy risk-taking, which is important for people too, because that pushes them, maybe outside of their comfort zone, but to do things that are really healthy and will engage them in good self-care practices.
Okay. Do you see any trends in self-care as far as the world that we're in today and how that might have also adapted to what people are living with, having COVID as part of their lives?
Sure. I think we've seen some drastic changes in the last year and a half. People are seeking out therapy more, which is great. I think everyone should have therapy. Everybody benefits from having a safe space to talk about their experiences, right? So we're seeing an increase in that. We're seeing people doing more digital detoxes. We're on screens all the time now. So people want to detach from it. That's helpful.
So Alex, what percentage of your clients would you estimate come to your practice with problems that can be aided with self-care or self-improvement?
100%. Everybody who walks in our doors can be aided in engaging in self-care practice. Everybody will benefit from this. So some clients may have already established a self-care routine and just may need a little support in increasing their consistency with it, and others may be starting from scratch. But it's very important for all of our clients and individuals in general to have good mental and emotional hygiene and a mindfulness and self-care practice that's established and consistent. It'll aid our emotional state, improve our ability to face challenges and stressors.
You can contact Alex Herrera at 571-234-9184 or go to her website at everwentherapy.com. Thank you.